everybody. My name is Tom Armstrong. I'm a partner at the law firm of White, Summers, Caffey, and James. I'm going to be moderator for this session. Well, first I want to thank Ahmad Thomas for his keynote presentation. I think some very important and very interesting points he made. And so again, I wanted to thank him for presenting this morning. For our session, we have three great companies that are going to pitch to a panel of investors. The three companies are Infiniral, Plum One, and Airset. Each of these companies will have 10 minutes for their presentation to pitch the investor panel. After their presentation, there's going to be 5 minutes of Q&A from the investor panel. They can ask questions from to the presenter of the company. Our investor panel consists of Gary Sifrin. Just a quick bio on Gary. Gary's a serial entrepreneur and angel investor. He co-founded driversed.com, and he is the co-founder and CEO of a new startup called Gravy. His expertise includes strategy, business development, marketing, and media purchasing. On the panel, we also have Richard Haydick. Dick has extensive management experience in the life science industry, serving as CEO or managing director on multiple occasions for many companies. Through his consulting company, Dick mentors CEOs of emerging biotech companies, as well as social entrepreneurs in the developing world. You can find out more about the panelists and myself on the event website. So with that, we will call our first company, which is Infiniral, to the stage. I think Bert Wank is going to do the presentation. Infiniral provides an early warning system to prevent EV plus renewable energy failures. And Bert, hopefully, there you are. Hello, Bert. Good morning.
Well, good morning, Monterey Bay from Albuquerque, New Mexico.
That's great. Good to see you, Bert. Bert, if you can, you're going to please share your screen with your presentation.
Okay, let me see which one it is going to. Screen 2. No, Chrome wants to do a screen recording. Okay, why is that? Let me open system preferences. No, let me do deny and share. And if I go to play, let's see, see what happens. It's churning. Oh, nothing happened. What is this? Hang on. Why is it works perfect in Zoom, and now I don't see this.
Bert, would it help if I pull up the screen and share the screen for you?
Maybe. Hang on. I did this just with Keynote. Okay. How does it look now?
We can't see anything.
Oh, you can't see anything? Okay. Now where is the?
Bert, how about if I share? I can pull it up.
And then you can pull it up. Okay, let's do that. Of course, then you don't get my cues very well with the transitions.
Tell me what to change. Okay?
No, I don't see anything. I don't see any application on here. Hang on, it must be under Chrome. All right, I don't know where we at. I'm really sorry, this does not work.
Oh, there we go.
All right, okay, here we go. All right.
No problem.
Excellent. So thank you for the smooth recovery.
Yeah, no problem. So Bert,
go ahead.
If you're all set there, you have 10 minutes to pitch, and then you'll get a warning as the time is winding down.
Okay. Well, I got a timer here too, and then I just tell advance. That's how it works, right?
Yep.
Good. All right. Good morning, Monterey Bay, esteemed investor panel, and Tom and the audience. I'm Bert Wank. I'm the founder and CEO of Infiniral Corporation. Infiniral stands for Infinite Reliability. Wait a second. That is not the right presentation. I'm just seeing this. This is okay. Excuse me, but there is a deck that Hillary uploaded yesterday to Lynette. Can we get that one? Okay. Let me try that screen share again. This is, I'm sorry, this is really not working. Let me try this again. It's gotta work. If it works on Zoom, it should work on here as well. Share that window, and if I play this one, okay, is this coming on now? Do you see a green background?
No, Bert.
Bert,
You don't see a green background.
Bert, on the bottom of your screen,
Yeah,
there is a little arrow button. And
I clicked that. I clicked that, and it shares. And I shared the screen where the presentation is on, and it doesn't compute. It says present to audience, share screen. Let me share the other screen. I don't know if that happens. The browser is not permitted to share screen.
Are you using Chrome?
I do.
Can you convert it?
No, it doesn't work. It screwed up everything. I tried that yesterday with PowerPoint.
Well, Bert.
All right. Okay. Let's redact to the presentation you had. It's just for a different type of crowd, but it works again, and it's designed for 10 minutes. So let's resume for that. Sorry for that. Can you restart again, please? Okay, I did my introduction. Please advance. Okay. All right. What happened there? Okay. Okay, so we have a solar industry that has 9 out of 10 failure reports coming from inverters. The service tickets that are issued to the maintenance team, 90% are related to a critical piece, which is called the inverter inside of a solar plant. Now, what that causes is cost overruns. The unexpected maintenance cost ramps up to about 5 times the budgeted amount, which then cuts the investor returns in half. And that's a big problem for investors too. The response is that the investors then say, well, we need to cut back on cost. And where do they cut? The maintenance. And that leads to a devil's circle. The devil's circle then causes less maintenance, which even triggers more inverters to be at risk and fail, and therefore it's a perpetuum and running down the profits. Please advance. entrepreneurial has developed a system to predict those failures. It's an early warning system, and you can compare that actually with an EKG, like for heartbeat monitor. It's very similar in process. The benefit it provides to the solar operators and asset managers, first of all, it increases uptime, and uptime means revenue. The second part, it reduces operation and maintenance costs, since now you actually repair the unit, which is about 1/10 of the cost than when you actually have to replace it and recover from all the damages. And lastly, by knowing the health of the system, you can actually intervene, de-stress it, and therefore extend that life of that critical asset. All of that together cuts the cost for inverter maintenance in half. And that's really the value proposition that we're providing, if you may advance. Our system is a combination of proprietary hardware, sensory, that is an instrument that is placed in the hands of this gentleman right here that runs a 10-minute test on those units. And it contains a secret sauce, which is high-performance signal processing. And to compare that, what was the state of the advancement of inverters today is that they are so cost-constrained they cannot put in high-performance computing power in the inverters. That will completely outprice them out of the market, so they can't do this. The second part, once we have those signals, we actually run algorithms that cake in our knowledge of the physics of power conversion why systems fail, how they fail. Those algorithms extract from that raw data a health signal. That's literally the cardiograph that we're talking about. And that's the data that we actually then present to advanced machine learning algorithms, the power of artificial intelligence. And together it brings us benefits, brings our clients the benefits that those two main competitors cannot achieve. The inverter companies cannot get to the data, and the third-party monitoring firm, they rely on the same data that the inverter produces. So they're stuck with insufficient data. Infinuel has got the data it collects itself that allows us to predict failure and then increase uptime, which means more revenue, reduce cost, and by actually allowing those inverters to operate longer, we also reduce the waste that is going on the landfill, because now the assets live longer. If you may advance, please. This service that we're providing based on our instrumentation gives our clients and our target market, which is out of warranty inverters, a 10x ROI. And that's about the tune of $350,000 per year, every year. And this is based on a plant our chief marketing officer actually has serviced in this past. And later on, as we grow the business, we also can include the inverters that still are under warranty, which also are subject to failures, as we've seen. The ROI is then 3x. The key is that we actually can intervene ahead of time and move the replacement costs, lower it by repairing the units under full control. And of course, the logistics is better as you're in the knowledge of what fails. You can order parts, which is today even more critical with supply chain constraints. Please advance. So based on the single plants, we roll out the number globally. And that business can amount to a $500 million business in itself, which is a good portion of the $5 billion market on PV solar operation and maintenance. And that market is poised to double in the next 5 years. So there's one growth opportunity. But more importantly, we grow with our customers as well. Now, we one plant and then add more plants from the same customers, and our customers have already forecasted a 10x growth in the next 5 years. Each one of them. That means there's a compounding of revenue growth. On top of that, our technology is transferable not only to solar electronics, but the same electronics is used for wind power and energy storage system, battery energy storage system. And that gives a great foreshadowing of the growth potential that we have built in, because energy storage also applies to electric vehicles, which we get to later. If you may, actually, before you advance, one big point here. This is a strategic sale. A strategic sale is through one-on-one relationships with the asset managers. And so we grow from a handful of clients today to about hundreds in the next 5 years.
Bert,
And yes.
I'm sorry, but your time's up. So it's...
Okay, fine.
So, yeah, with maybe not as much information as they might need, but I'll now turn it over to investors if you have any questions for Bert. There's 5 minutes for Q&A, Bert, Gary, and Dick. So if anybody has a question, feel free to ask it.
Bert, this might have been your very next slide, but can you tell us a little bit about the validation of the technology and customer acceptance?
Thank you so much. Exactly. So we have a signed agreement with a global energy service provider, actually a binding agreement to pilot test, which is our next step that we do, and then convert that pilot test into actual first revenue. We also have 3 letters of intent from similar clients globally. And then we have a technology validation. Currently, I'm actually finishing today testing at Sandia National Labs, which has been coming through a voucher we won through the American Made Solar Challenge, a Department of Energy program. We also have won the $500K award from the CalSEED, California Energy Commission grant for the same work on our proposal to make energy more reliable.
Bert, thank you for the presentation so far as you've gotten it. I had a question about the regulatory environment. is there any are there any regulatory constraints or any particular licenses that you have to carry, and does that change from jurisdiction to jurisdiction?
Actually, it's a great question, but fortunately, we actually don't touch the equipment. We're really a data company that has an instrument, which of course we'll need to eventually UL approve, but that's pretty generic to do that. Our clients administer the test. We train them during our onboarding process, essentially one-day training to utilize and work their schedule. Essentially, we integrate into their testing schedule itself. The good legislation is that for our growth potential, California has actually put in law that all new solar plants have to have energy storage. Right? That's actually favorable in our case because we can really expand our market.
Forgive my ignorance here, but are all solar plants the same, or are there different sizes and different? Oh, yeah. And is your technology kind of applicable across the array of solar plants?
Yes, actually, it's actually true. Every single plant is differently. So we have a service level agreement as a business model, which has been done in energy because they write contracts for like 25 years. It's been on telecom. And the let's see, did I ask at least a portion of your question, right?
Yeah.
Okay. There's a second part that I just missed. I just have a hunch I missed one part that you asked.
No, I'd asked whether all the solar plants are the same size,
yeah,
whether your technology is applicable really across the board.
Yes, actually, they're very agnostic, right? We're looking at the physics, right? Our monitoring competitors, they have to write APIs to each and every make and model, and every year and again, right? It's a burden. We don't have that, right? We're looking at the power conversion physics, look at the signal and extract it, so we can work with legacy equipment, which is our market entry point, and we can work with future parts. But we also build in on the same platform. Essentially, that's my whole core spin philosophy. The same technology works with energy storage. It still works with electric vehicles. It works with air taxis. Anything that has power electronics at its core have the same physics behind it. And that's where we need to make minor adaptations, but that's a small matter of programming rather than a revision.
Bert, if the pilot goes the way you're aiming for it to go, what are the resources you need to scale this to the next level?
Yeah. So in our plan, we're currently raising $1 million to really turn our pilot tests into the first $1 million of revenue with 15 energy plants that we look for. We partner very strongly with machine learning. We do need to bring some of these resources in-house, so that's where part of the funding goes towards. We need to have to onboard some of the customer service application engineers behind it, build out the database architecture as well to handle the data that we do. So currently we do this all through partnering. And then clearly there's a bunch of R&D work to cost reduce it in order to scale up, right? So currently we buy everything off the shelf and modify it. We bring this down to a small embedded system, which is part of the R&D budget. And that allows us to get the cost down to about 1/5 of what we're paying today. And with that, we can actually address plants, not only the very large ones, but also smaller plants that are actually mostly the older plants as well, like 10, 20 megawatts plants down to 2, which is the entry level for utility scale. We picked that market because it's more than three quarters of the global market is the large scale utility plants. And we're factoring by dollars per capacity, dollars per megawatt. That's our factoring model. That's why we're looking at the big plants.
Is capital access the rate limiting factor for scaling, or are there other things that will be challenges for you? If you had twice as much money, would that be a good thing or a bad thing?
Oh, it's always a good thing, right? So in our financing forecast, the total financing we forecasted in 3 rounds, seed A and B, is 18 million. So we're looking for 1 now. 5 would get us to the embedded cost-reduced version, and then the 12 will scale up into multiple product lines and global operation as we scale from US, California, US, Europe, and then the rest of the world. And the hardware cost initially is the driver. So I'm actually have already quotes in for cost reduction. That's going to be a critical part in scaling up, is getting our hardware costs into the field. A beautiful thing to also notice is that delivery model is not on a per unit basis, right? Inverter manufacturers are all per unit basis. We actually servicing multiple inverters per plant with a single unit, multiple plants per customer with a single unit, And depending on the overall size, we can manage about 20 megawatts per week, per unit. We can actually service multiple customers with the same instrument, right? So we only need to build hundreds instead of millions, right? And that makes it a very capital efficient model, but we do need to have the first couple dozen instrumentation units in the field, and they're costing 5 times as much than I really do eventually, right? That's really makes that 3-year break-even mark a critical point where we do need to have some capital, some working capital to work with.
Okay, great. Well, Bert, that's the end of the time for the Q&A session. And Bert, I want to thank you for your presentation and handling the bad hop. So that's greatly appreciated. If you're interested in learning more about Infiniral, there's contact information on the event website, and you can also visit the virtual lounge at the website. So Bert, again, thank you very much.
Okay. Thank you for having me. Amazing, Tom. Appreciate it.
You bet.
Bye-bye. So I'll be whisked away now, right?
Yes. Okay. So our next company giving a presentation is Plum.One. So hopefully they will enter the stage. I believe Adam Gordon is going to be doing the presentation. Yes, there we go. Plum.One is a new search engine that offers in-depth results without intruding on the rest of your life. So I'm fascinated to hear this pitch. Waiting for Adam to join in.
Okay, we should be coming in.
All right, Adam, welcome.
Look at that, it all works. Boy, it's great when it actually works.
Yeah, Adam, awesome.
Good morning, everybody. I'll also turn on my camera so you can see me. Good morning, everybody. It's really a pleasure to be here. Nice to, Tom, in your case, see you again and to meet the rest of the judges. Very excited to do this. I think we've got a very exciting product, and I'll just get right into it. So my name is Adam Gordon. With me this morning is also Steve Marshall. We are the co-founders of Plum.One. It's a new independent search engine. And when people hear the word new search engine, they always have the same 2 questions, which are, do we really need another search engine, and can we possibly compete? And I just have a couple of points about those questions. Those same questions have been asked by just about everybody who's launched a search engine since Tim Berners-Lee launched the first one in 1997 at CERN. And I have a question back for you in response to that, which is, does anybody here think that we're using the last search engine that we're ever going to use? And if you do think that, feel free to pull out your phone, start checking your email, whatever. If you don't think that, then you agree with us that there's opportunity in the search market, and let's continue on. So just take a quick step back and take a look at the market. I don't need to belabor the point that it's huge. It's the largest market ever in the history of the world. If you look at the amount of transactions on a day-to-day basis, there's between 15 and 20 billion of them. So it's very, very active. And I think the salient points on this slide are, first of all, it is huge. It could be a $140 billion market worldwide, and that's really our TAM. Our SAM is really the American search market, and that's 20 to 35 billion, again, depending on who you listen to. But the salient point here is that Google grew by itself from Q1 of 2020 to Q1 of 2021, 34%. And that seems to be that growth rate seems to be very strong across the market, with a lot of different analysts predicting the best years of search growth yet to come. So it's a very large, very strongly growing market. And so in answer to those first 2 questions, do we really need another search engine, and can we possibly compete? The answer is a resounding yes. And there's 3 high-level reasons. I'll dig into the details of all of these in a minute. But the first one is that search is changing. How we search and what we search for is starting to change, with the result that a lot of the time, or some of the time, we're just not finding what we're looking for very easily. And that's opening up niches in the market that Plum is really well positioned to take advantage of. And the second is the business model of surveillance capitalism is really starting to come under fire. And it's going to be, in the next couple of years, a more expensive space, a more expensive way to operate, a more expensive space to operate in, with a lot of regulation, threats to break up Google. We all see this happening every week in the news. There's new stuff coming out about that. Again, opening up new niches in the market that we're well positioned to take advantage of. And the third is that there's a new technology growing on the web right now, the decentralized technology. It's called Web3. It's really the web on the blockchain. It's called Web3, or Interplanetary File System, IPFS, which is the file storage system that's decentralized, and dApps, which are decentralized apps where the functionality actually gets spread across different devices. And this whole world is going to need search, and we've got the alpha of a search engine for it. So looking at point number one of how search is changing, we all have the experience every day of doing what I call a shallow search for something like cat food, where the first results that you get are fine, but then also switching to something that's somewhat deeper. For instance, looking for treatment for a genetic disease. And in those cases, we're really looking for deeper, more nuanced, more a broader set of results. And in those cases, Plum is just a better search product because we don't skew your results the same way that the large search engines do. We don't have the same kind of economic incentives to do that. And so our results tend to be broader and deeper than any other search engine. And people are finding stuff on Plum that they can't find anywhere else. And the final point about this is that in the Web3 world, in this distributed world, being part of a community is going to be an important part of being able to operate in that world. And the surveillance capitalists just aren't going to be able to do that. So Plum is Plum is a new option that gives you a faster path to in-depth results. And when you're looking for things that are more subtle and more nuanced answers, Plum is just a faster way to get there. We consume no customer data whatsoever. We think that privacy is a low bar for a search engine. We think that, of course, search engines should be private. A lot of times we search for very private stuff because we break people out of that. We don't do personalized search. We break people out of their filter bubbles, so people are discovering things that they can't find anywhere else on Plum. We don't track anything, and we are absolutely ready to enter the decentralized world. We've got an alpha of the IPFS search engine that I can show you today. We are capitalists without the surveillance. And this is an example of what you see when you search for something on Google and Plum. In this case, it was for the neuroscience of meditation. And if you look at the very left side there at the top of the Google page, if that result is your answer, great, you're done, you don't need anything else. In this case, I was looking for something deeper, and you can see that those deeper results in the next part of the slide there are pretty far down the Google page. And they're way at the top of the Plum page. And if you look at that in more detail, you will see that the results on Plum not only are a broader set of results, but they're a deeper set of results. Things like PubMed come up much more frequently. So we're really giving people a faster path to higher relevant content. We've got an extremely strong team. I've been leading marketing for startups very successfully for a number of years. Steve Marshall, our chief product officer and my co-founder, is the CEO of Jabiru, which is known throughout the world and is always listed as one of the top privacy search engines in the world. And then our interim executives, which augment our executive team, are all extremely senior people. They have all raised money and exited companies before. Stacy is somebody that I really want to point out. She's a very good designer, one of the top designers in the Bay Area. And I'm a big believer that design is going to be an important part of how search evolves in the future. And then Neil and Fred are both experts in their field of finance and cybersecurity, respectively. So our technology today is pretty straightforward. We've built our own index, which is one of the reasons we're able to surface such a broad set of results so quickly. And our own algorithms to rank those.
3 minutes.
Thank you. To rank those results. And those represent 25 years of development. And those are all live right now on our mobile apps and our website and in our IPFS search engine. And we've gone in with very light marketing from 25,000 searches in in July to 35,000 searches in August, which was a 35% growth. And September is looking like it's going to track the same thing. This is what we see of our competitors. I think one of the interesting points here is we're the only search engine out there that uses a hybrid set of indexes, our own and then Google's as well. The other one of note here is StartPage, which just had a major investment from System 1. I'm just showing that there's a lot of investment interest in the search community right now. 5 revenue streams, 2 of which, the top 2 of which are the only 2 that we're using for projections here. The others get into some details about how we're going to partner with other search engines out there, and we've been approached by other search engines to license our independent index. And then the blockchain world is like the web in 1995 right now. We can't predict what the future of that is going to be, but we know it's going to be huge. Sorry, the business model got dropped off of this presentation. I apologize about that. But the business model, what it will show you is that we've got a very strong model. Search is a very good business. In 5 years, we're projecting to be a $40 million company with very high margins. And we're asking to raise, we're looking to raise $500,000 to help us get there. And that can be done in any number of series, and the use of those funds will be mainly to grow the company. That's 60% of the projection, and 20% each to finish the development of the blockchain search engine and to continue running the company. My name is Adam Gordon, and my contact information is all here in the system. Thank you very much, and I'm ready to take any questions you got.
Great. Thanks so much, Adam. Great presentation.
Thank you.
But now we have, again, 5 minutes for Q&A from the panelists. So if they have any questions, feel free to ask away.
Adam, thanks for. Oh, go ahead, Richard.
Okay. Adam, fascinating stuff.
Thank you.
And I share the Google frustration every time I look for something, I can't find it anymore. How do you keep yourself from falling into their same traps of advertising revenue being a distraction to your user, but a big source of your revenue? It just seems like a conflict in some ways.
Yeah, well, we believe that one of the important parts about this is how things are presented. And the way we'll be presenting ads is to make them a little bit more apparent. We're going to attempt to get them out of the mainstream of the organic content and put them back where they used to be, off to the side, so that they're not a distraction to people getting to high relevancy content faster. Because that's really what we're all about, is getting you a broader set of results for your search as quickly as possible.
And have you tested with consumers who are doing your searches now to see what their reaction is to your approach?
So far, it's been extremely positive. We've gotten a lot of positive notes and a lot of positive mail. People telling us that they're able to find stuff that they can't find anywhere else. I hear that every week. And people also really noting that they really like the fact that they don't buy a pair of socks on the internet and then get an ad for the same set of socks for the next 3 months.
Right, yeah.
Thank you for the presentation, Saul. It's really interesting search. That's a very interesting space. But so much of Google's success is not just on the search side for the consumer facing, but also on the Google Ads, what used to be AdWords side, and the very complex auctioning that happens. And so, since part of your model is going to be ads, how do you optimize? Because that's the big piece for Google, is that they got that part so right.
Right. Well, so a couple of points about that. The first of all, our ads won't be tracked. So it's going to be a much simpler system to get ads up there. And what we're looking at right now is simply rotating ads up based on the content of a search. So we're not tracking anybody. We're not looking at anybody's browser history. When you search for socks, we'll show you ads for socks. And then that history will completely go away. So we're looking at a much simpler system that's just going to rotate ads in on a sequential basis.
And the basic principle for Plum is that it's meant to be total consumer facing. It's not a specialized search. So you gave the example of PubMed. It's not the case that a user would use Plum for particular needs. Like you gave the example of I have a genetic issue and I want to go and look at that.
Yeah. So there is a part of the business model that's a B2C business model. And because Plum is a better search engine for doing deeper kinds of research, we're anticipating that there's also verticals out there like journalists, scientists, business researchers that will be able to use Plum on a more specialized basis and provide that level of search to those particular verticals as well. So that is part of our business model.
Is that a potential go-to-market strategy where one could start there rather than trying to compete with Google and have to kind of because that sounds really expensive, to broadcast what Plum is as a better version of Google versus going the specialty route and maybe perhaps charging a subscription to an institution for, say, a university or journalists or something like that?
That is absolutely part of our go-to-market plan.
I see.
Yes.
Adam, what is in it for the advertiser to advertise with you instead of all of that range of services they get when they get targeted advertising with Google?
So I'm not anticipating that our ads are going to be as expensive as Google because we're not targeted. So the advertisers are simply going to have to live within our ecosystem in order to be able to play there. Once the system growth, once the company growth gets up there and we're doing a couple 100,000 searches a month or a day, then we'll be a very valuable place to be advertising even though we're not targeting the ads. So I anticipate that one of the benefits we'll have is we'll have a less expensive form of advertising, and it won't be targeted so that you'll know that you're advertising for people who are searching for cars, but you won't know that they're males or 34 living in a certain geography. So just a different model of how advertising is going to work inside search.
Great. Well, that's our 5 minutes for the Q&A. Adam, thank you very much for the presentation. If you want to know more about Plum.com, again, the contact information is on the event website, and you can also visit them in the virtual lounge on the website. So again, Adam, thanks so much.
Thank you very much, everybody.
All right. Okay, we are now to our third and final company for this session, and that next company is called AirSet, and so we want to welcome them to the stage. I believe Devin Carlson will be giving the presentation for AirSet.
That is correct.
There you go, Devin. Good to see you. Good morning.
Getting you set up here.
Yeah, while you're doing that, let me just a brief mention about AirSet. AirSet's building an industry-first smart damper that provides unprecedented airflow monitoring and control designed specifically for healthcare settings. Don't know if that does it justice, Devin, but interested in hearing the presentation.
I'll do my best to fill the blanks here. Thank you, folks, for your time. Today we're going to talk a little bit about hospital air quality. This is an area that, it's a passion project for me. My wife works at Natividad Hospital. My cousin's an ER doc there as well. And providing, the safest work environments for those folks and for patients, for the hospital goers. All of that is really our focus here today. So let me fill in the backstory. Now, hospitals are legally required to provide engineered air throughout the entire building. Each room has classifications and a whole variety of parameters like number of air exchanges per hour or the pressure differentials between adjoining spaces. And all these rules are all in place to try and mitigate aerosol pathogen spread. So, but there's a problem with this setup. The final moment of control, that point where air exits the system and enters the room, is controlled by one of these things. It's called a manual volume damper. These are coarse grain control mechanisms. They're prone to human error. They need to be readjusted periodically. It is a labor-intensive piece of sheet metal in front of you right here. There's an entire industry of licensed contractors that perform what are called air test and balance procedures. Now, this involves going to each vent in a hospital, holding up one of those air hoods that you see in the screen here, measuring how much air is flowing through, making a manual adjustment to that manual volume damper, and then going to each vent in an iterative process to try and get the whole system to balance out. Now, this is expensive. It's $75 to $150 per vent. So a small to mid-sized hospital can easily spend upwards of $50,000 to $75,000 for a single snapshot in time, right? The air balance report that you get on September 23rd might be invalid on September 24th due to system drift or reconfiguration or equipment moving throughout the building. Our experience with this problem, our firsthand experience designing hospital HVAC systems, has led us to develop a technologically advanced solution to this problem. So we've developed a smart damper. The smart damper automatically senses and adjusts to control the amount of air flowing through each vent. Each damper is independently operated and automatically senses and adjusts, but the entire system is networked together to provide building-wide visualization and control. We can connect these into the building information management system to raise alerts if areas fall out of spec. These can be configured remotely and in real time, so as maybe a hospital wing gets reconfigured into a COVID wing as a surge comes up, we can create those positive and negative pressure differentials on the fly with the system. Now, we're focused on the hospital side first because that's really where the policy requirement is. Hospitals have to get this right in order to have occupancy in their spaces. So we've developed an air balance as a service business model, effectively coupling the device sale as well as the software subscription that provides data visualization, the building information management system integration, and then also certified air balance reports on demand. This is a pretty big industry, right, and a pretty big market opportunity. These numbers here are really just for hospitals specifically. The product that we've developed is a retrofit device that fits into any existing HVAC system. So really the hospital is just the entry point for the market for the company. We really can take this to all commercial spaces. We can couple these devices into occupancy sensors and then have room by room airflow control based on who's actually in the building. Especially now with large commercial spaces being mostly unused, it would be nice to be able to gain energy efficiency by controlling airflow to just the areas where people are actually operating and working. To get this going, to get this to market, we see two initial paths forward. The HVAC design engineer knows this problem intimately, right? These are folks who have experienced air balance holdups, budget delays, project delays, things that cause their whole workflow to fall apart because they can't get an air balanced system. Of course, these are engineers, so they're looking for a robust scenario. So really, to address their needs, we need to have a test facility where we can show how this works. We can do training and education and work with those folks to show how the benefits of the system can really help with their workflow. The other source or the other path to market really will be for the hospital execs. Coming at it from the other side, they also see the problems associated with air balancing in terms of budgeting, in terms of, you've remodeled a space, but you can't occupy that space until you have that certified air balance report. So these folks know that they need a better solution, and this is the solution that can help. So our team is very deep in the HVAC engineering world, right? We have decades of experience designing these systems, so we know the industry players, we know a wide network of architects and engineers and contractors who all work in that HVAC world, specifically in healthcare facilities. We've designed products, we've designed sensors, we have that knowledge base to really push this thing forward. So far, we've been privately funded, personally funded. The base research and development is there. We have our proof of concept models. What we really need to do pushing forward into year 2 is to get that first test set up, installed. So maybe in a non-patient wing of a hospital, some area where we can prove that this is in fact working the way it needs to work, and then use that as the stepping stone to get into the year 3, 4, and 5, where we can start to see revenue generation from the device sales as well as the subscription model. So to that end, we are seeking fundraising. We have applied for an NSF SBIR grant. In addition to those monies, we're also looking for angel investment. In a perfect world, we would find an angel investor that would have some affiliation with a hospital group, so that we can then use that affiliation to gain access to that test facility so we can install this and get that up and running. We are seeking $200,000 in convertible notes with negotiable terms at this point. As you saw on the team slide, we really are engineering focused. So some of that money, some of that fundraising money needs to go towards the sales and marketing outreach side to really drive this thing forward. So there it is, hospital air balancing. It is a serious problem. We're tired of dealing with it on a day-to-day basis, and it's time now to develop the damper control system and get it out in the world and make our hospitals safe for everybody. Thank you guys so much for your time tonight. I look forward to your questions.
Great. Devin, thanks so much for your great presentation. We have 5 minutes for Q&A. So if the investors have questions, shoot away.
Devin, this is really fantastic and also obviously very timely. and as you point out, it's not only hospitals, but there'll be lots of use. I can very well imagine schools having a particular interest in this. I have lots of questions, kind of less on the business and more on the engineering. Like, how do you do it? Like, where do the sensors live? But I guess I'll ask a related question, which is more closely related to the business side. If you have a building, let's say a hospital in your example, do you have to replace all the vents with this solution in order to have in order for it to work at all?
No. So the system's independently operated, right? So you can replace just certain areas. First off, each device is a 4-inch stack height, so it fits right in between the flexible ducting and the rigid diffuser vent, so it just fits right in there. Since they're independently operated, they can act alone. If you have the entire system going, then you can see that building wide visualization. You can see how the whole system is working. But the independent works just fine.
I know in hospitals there are certain rooms that have negative pressure.
Right.
And so does this play nice with that system, or is this separate from that?
That's the exact point, right? That's air balancing. So that negative pressure space is essentially what you're doing is you're sucking out more air. You're sucking out 500 CFM from the exhaust air, and you're only supplying 250 CFM. So you've got that negative differential of 250. If you've got a damper control device on the exhaust and the supply, and you can tune both of those to be 250 on the supply and 500 on the exhaust, then you just automatically can create that.
I don't want to monopolize the question, but the question Q&A here. But one other question: when it's used in a hospital, is this a medical device, or does this have a regulatory component?
Right. I feel
like I'm asking the same question over and over.
The state of the industry is that we're using those manual volume dampers. So it's not a medical device. It's part of the HVAC system. What is regulated by OSHPD is your system in balance? Are you creating the correct number of air exchanges per hour? All those parameters on a room-by-room classification, that's what's regulated. The means by which we get there is not regulated.
Devin, this looks really important work, and congratulations on that. What are the challenges, what are the data and the persuasion and the logic that you use to convince somebody that this is worth piloting?
Yeah, no, that's a great point. The thing is that there's a lot of hospital remodel projects that we know of that are stuck right now. Maybe you've got a very large 7-story building and you're only remodeling one small area of that. Okay, if you want to remodel that one small area of that, you have to have the entire building balanced. You have to prove in a pre-read that the entire building is balanced. So hospital execs know that to get this one thing done, you have to have the whole thing working. So they know the pain right then and there. In order to get a test facility, I think we need to focus on a non-patient area, a small wing of a small clinic that might not be, a convalescence room or an operating theater or something critical like that. But to show that this works, we go to the non-patient areas, we install it there, and get that ball on.
And I gathered from your presentation that you're looking for funding so that you can do the pilot. Is there any opportunity to reverse that and say, get a letter of intent or get some sort of a commitment that you can show to an investor to give them more comfort in their investment?
Right. So for that NSF SBIR grant, we have support letters. So that's exactly what we're trying to do, is to try and get those folks to give us those, either it's a support letter or a letter of intent or something that says, hey, I'm an ER doc and this matters to me. I'm an engineer, this matters to me. I'm a hospital, this matters to me. So part of that application process includes those.
And could you move that one step further to some sort of letter of intent?
We're hoping for it. At this point, we haven't gotten there yet. That's where we're trying.
That would change life a lot, I would think.
Yeah, definitely.
Maybe that's been obvious to you from your day one.
I've been thinking about that a few times.
What about the contractors that actually do the building? For like you were giving the example of hospitals that are remodeling, right? It's not the hospital. The hospital doesn't have their own contract, right? They're hiring a contractor that's going to come in and do that. Is that a point of entry at all?
Oh no, absolutely. So typically, the contractor and the architect are going to subcontract out to a design engineer, an HVAC design engineer, to design an element of the system. And so those folks are going to specify this product on the plans, and then the contractor will install.
And are those relationships that you have been cultivating as well in the same way that you're looking for LOIs from hospital administrators?
Right, exactly. So looking at that design side, looking at the HVAC engineers, that's also where we're trying to go with this. So, yeah, my co-founder Brandon Rogers, he owns a mechanical engineering firm. That's where we kind of came up with this idea. He works specifically with hospital engineering HVAC systems. So we know a lot of the folks that exist in this world, and we're working with them.
Great.
Devin, is there any relationship between COVID as a window of opportunity and the fact that may start to shrink, or is that extraneous to what you're doing? Is COVID part of the action for you?
I mean, I think it absolutely is. It has highlighted that this is a need. When you hear stories about how hospitals are reconfigured, so I mentioned my wife works in Natividad. Their pediatrics wing got reconfigured into a COVID wing, and then it got reconfigured back to pediatrics, and now it's back to COVID again because of the Delta surge. The folks that work there, they've got big supply airs hanging out in they've got ductwork that's exposed. It's running through the hallways. They're doing ad hoc positive and negative pressure space development just kind of as they go to try and make this work. So I think everybody sees it, and now it's a wonderful opportunity to go to them and say, this is the solution. Here we go.
There was just an article in the Atlantic about this issue. I'll dig it up. I'll dig it up and try to send it to you.
Nice.
Well, nice point actually to end on, and very relevant. Devin, that's the end of the time for Q&A. Again, thank you very much for your great presentation.
Thank you. I appreciate the time.
Yeah, no sweat. If you want to learn more about Devin and his company, you can, again, there's information on the event website. You can also visit the virtual lounge and learn more about the company, AirSet. That's it for this panel. Again, thanks to all of the companies, and also thank you very much to Gary and Dick for your great questions and helping us today on being on the panel. I think my understanding is there's a 5-minute break until the next session for the event. You should be magically moved back to the lounge area, and the next event should be coming up shortly. Thanks, everybody. Take care.